other thing is, there's a lot, but just to kind of narrow it down a bit more, Governor Murphy, I think a couple months ago, passed 6 different pieces of legislation aimed towards substance abuse. One of them was, surveying school children about their history with substances, what they know about it, potential use, to kind of, again, early intervention or prevention, and additional funding surrounding that. There was also funding passed with DCF and substance abuse and placement of children, guidelines for that. And then health issues, Medicaid and other state bodies providing payment to continue providing payment for substance abuse services via telehealth. The other major thing was telehealth being able to be provided across state lines. There was waiving of licensure for MDs to not be able to need to be licensed in that state to see a person who might have been out of state at school, etc. So there's been a lot of movement and a lot of positive movement. In terms of going forward, what we'd like to see is, the Ryan Haidt Act, I think, is important to be able to kind of see a patient virtually and be able to, facilitate a home induction. I think might reduce the barriers to care significantly. Other things, in terms of state licensure, I don't know, Dr. LaPietra, I think you probably agree with me, but needing a license in every single state independently kind of really affects, especially being in the, a metropolitan area where we have patients who are going to New York for work or might go to New York for school or to Connecticut for this. A lot of students that I have who will go away to college to other states, etc. For the continuity of care, right? I think it would be really significant to be able to kind of tackle that barrier. Increased accessibility and flexibility in methadone maintenance programs, even though we don't provide it. The pandemic allowed for increased ability to have take-home doses and things of that nature, so that these individuals who might be working and might be further in their recovery don't necessarily need to feel as though they're chained to this center where they have to go every day. I can go on about this all day, but I'm just going to stop myself. But a lot could be done, and a lot has been done. And telehealth and this virtual or hybrid healthcare model that we are in, I think, is here to stay, and hopefully it's for the better.